The numbers are finally available for the 2025 Medicare costs, and the big question that I want to answer in this video is, will your costs be higher if you decide to go with a Medicare Advantage plan or a supplement plan? Now, I'm going to get right into the numbers, but there are some liberties, and a disclaimer will be coming later on these numbers that I did take, and we'll discuss that later on after we get through all the numbers. So if you can, please hold off on harsh judgments in the comments until we get there. And if that's not possible, I understand, we're still friends, but I don't know if I'm the person for you to actually help. But I do have a secret comic code hidden in the video that will help me manage the comments a little bit better. And without further ado, let's get right into the numbers. Now, we obviously have to start with Original Medicare, which is Part A and Part B. And for majority of Americans, which is 99% of Americans, Part A is going to have a $0 premium per month. And these costs will be the same whether you decide to choose a supplement plan, which in this case will be a Plan G, or an Advantage plan. Well, kinda, because you actually have to qualify for this, and if you do qualify, that means that you or your spouse worked 40 quarters, 10 years, and have paid into the Medicare system over your working lifetime. Part B, on the other hand, does have a premium, and the 2025 base premium will be $185 per month or $2,220 per year. And this will also be the same if you decide to choose a supplement plan, in this case again, Plan G, or an Advantage plan. The key words here though are base premium, because this is based on your income from 2 years prior. So if you had a higher income than $106,000 if you decided to file single, or $212,000 if you're filing jointly and you're married, you could possibly pay more for your plan per month. And this is known as your income-related monthly adjustment amount, otherwise known as IRMA. And there will be a comparison chart linked below that describes the cutoff amounts. All right, so those are the costs for Original Medicare, but Original Medicare does leave some gaps that you will need to fill. And most people decide to fill those gaps with the plans that I mentioned earlier, which would be a supplement plan or an Advantage plan. Now, if we're talking about a supplement plan, just to have the plan, you have to pay a monthly premium, and the actual out-of-pocket amount will be different depending on your area. So you'll want to go to medicare.gov/plan compare, then enter your zip code and any medications that you have, so that you can find your exact amounts. You can also go to ehealthmedicareplans.com and find those same amounts as well. But supplement plans do tend to go up each year, so it should be no surprise that you will see a bump in the 2025 year as well. And the average for a 65-year-old looking for a Plan G supplement plan will be around $165 per month per person, or $1,980 per person annually. Now keep in mind, there will be times where this is lower or higher, but on average, this is the number that you could expect to see. And I want to make a note here, if you get a supplement plan, you will have to pay this monthly or annual premium even if you don't have any medical costs. However, for an Advantage plan, this is a very different story, because according to the Kaiser Family Foundation, in 2024, around 75% of Americans have a $0 premium plan. 75% of Americans with an Advantage plan that includes drug coverage, meaning that they pay $0 per month for this plan in terms of an Advantage plan. Now, I need you to keep in mind that this is data for 2024, and we do not have data for 2025 just yet. But the assumption or liberty that I'm taking here will be that this number will probably come down a little bit based on the changes that are happening in 2025. Now, they could stay the same, but from what I understand and know so far, I highly doubt that. But again, the vast majority of Advantage plans are on a $0 monthly premium. But for those that do have a premium, the average is about $17.50 a month in the coming year of 2025. But again, I have to say the vast majority will have a $0 premium, and we're going to take that number as the rule, not the exception. So if you're comparing as close to apples as possible, we also now need to take a look at drug drug, dental, and vision, because most people want and or need these, but just know that none of these are required to go along with your supplement or advantage plan. Now, we'll first look at prescription drug coverage, which, as I mentioned, is Part D. And if you choose to go the sole supplement route, this does not include a Part D drug plan at all. So you would need to purchase a separate drug plan along with your supplement plan. Now, this is an absolute jungle for 2025, so I'm going to use the published CMS numbers on average that we have, which states that the average number or the average premium number for 2025 is $46.50, or around $565 per person per year. And this again is an average because there are plans that have $0 a month premiums, and there are others that have $100 or more premiums as well. And as I mentioned earlier, your advantage plans will be different because majority, that 75% number that I talked about earlier, majority of Americans will be on a $0 a month premium, and that's going to carry over into your drug costs as well because that's included inside of that number. Then when it comes to dental and adding your supplement plan, it's a similar story because supplement plans do not cover what you would expect to have covered in terms of basic dental coverage, and that includes your cleanings, your cavities, and things like that. So you will need to buy a dental plan or purchase a dental plan separate from your supplement plan. Now, for my area, the average is around $40, which would be $480 per year. And again, that's in the Chicago, Illinois market. So based on your area, things could be higher or lower. Now, when it comes to an advantage plan, most of your basic dental coverage is inside of that plan or included inside of that plan. So with that $0 coverage or with that $0 premium, you're actually getting the same thing. However, the amount of dental coverage could vary widely between plans. There are some that are very basic and there are others that are very stacked. So again, this depends on your area and which plan that you choose. And finally, vision, going in the sole supplement route, is again around the same story. You will have to purchase a separate vision plan to go along with your supplement. And the average cost for 2025 is going to be around $20 a month or $240 per year. And then again, basic coverage is included inside of your advantage plan. So with all those numbers laid out, we can now come up with our fixed cost for the coming plan year. And fixed cost means that even if you don't have any medical situations or need to use this at all, you're still going to have to pay for this per month or per year just to have it. And by the way, this is with the exception of those that are on Medicaid, meaning those with low or no income. You will have to pay for the Part B premium, so don't forget to add that in. Now, with a supplement plan, after rounding for easier math, we are looking at around $460 per month or $5,520 of premium per year. Then with the Advantage plan, you are just looking at the Part B premium, which is $185 per month, $2,220 per year. And also remember that there are some Advantage plans with smaller monthly premiums and givebacks as well, which could reduce this number. And if we were to stop this conversation right here, there are drastic differences for these two different plans. For the large majority of folks, the Advantage plan would be the obvious choice. And that would be a fair choice because this would practically be enough for most people. And for those people, they are choosing based on the fixed costs and fixed savings that they have inside of an Advantage plan. They are not willing to pay for something that they just will not use. But plot twist incoming. We are not stopping this video right here because there are way more variables that we have to talk about in terms of Medicare and things that you need to consider. Now, when I say variable and variable costs, what do I mean? Basically, what I mean here is there are costs and or things that you're not necessarily considering just looking at these numbers that are unique to your situation and your area as well, should you have to use the healthcare system. The first would be the deductible, which is a dollar amount that you have to pay before your plan actually kicks in and helps out to pay for anything. And with a supplement plan G in 2025, you will have to pay a deductible of $257 before the plan actually kicks in and helps out to pay again for anything. But that is an annual deductible, and once paid, you don't have to pay for it again until the next year. But most Advantage plans do not have a medical deductible, and your plan coverage will usually kick in immediately. There are, of course, exceptions to this rule, but we're going to go with the rule in this case and say that, again, you will not have to pay a medical deductible for an Advantage plan. The next thing that you may run into in terms of variable costs would be a copay or coinsurance. And with a supplement plan G, you will not have a copay or coinsurance, which is why Plan G has become one of the more popular supplement choices nationwide. In fact, 72% of supplement plan owners are on a Plan G plan. The next closest supplement plan would be Plan N, which is sitting at 9%. But on the flip side of that coin, Advantage plans do have a copay or coinsurance that will drastically differ based on the plan that you have, but we'll show the more important number here in a second. The next charge that you need to be aware of are excess charges, which is the money that you will have to pay if you decide to visit an out-of-network provider or hospital. And again, with a supplement plan G, those are covered. However, with other plans like Plan N, they are not covered. And then with a Advantage plan, you are confined within a network of providers and hospitals that you have to stay in. Otherwise, you will see a higher out-of-pocket cost, or you may be stuck with 100% of that cost because you decided again to go out of network. So to keep costs low, you will need to stay in network inside of your providers and hospitals. Then a max out-of-pocket will be the next variable that you have to worry about. And if we're talking about a Plan G, this will not apply so long as you pay your Plan G deductible, and as long as your procedures and services are Medicare approved and your provider has not opted out of Medicare completely. So in essence, you could say that your max out of pocket for a Plan G plan is $257, which again is your deductible. And oh, by the way, max out of pockets do not include monthly premium. But with an Advantage plan, as you probably might have guessed, you will have to pay some co-insurance or co-payments until you hit a max out of pocket, which annually averaged across the nation is $5,000. Again, there are areas where this is higher or lower, so please use Medicare.gov to find your specific numbers. But I do plan on doing more videos around this topic, and if you found this video helpful so far, please consider subscribing so you don't miss those when they actually come out. But quick note here, if you do have a medical emergency and you're out of your state or out of town inside of the state specifically, let's say you're on vacation, your Advantage plan is required to treat that as if you were in network. So again, for a specific example, let's say you were out of state or out of town visiting family or on vacation, you had a medical emergency, your Advantage plan will have to, I again repeat, will have to, by requirement, treat that as if you were in network. But also the max out of pocket for most is really hard to hit because, at least on average, 3 to 5% of people actually hit their max out of pocket. And one other thing I need to remind you of is that your deductible and max out of pocket are not the same. All right, so when we pull down the full list of numbers for variable costs in terms of an Advantage plan or a supplement plan, we can see that the total risk for a Plan G would be $257, while an Advantage plan variable risk cost would be around $5,000. And once again, if this were where we stop this video right here, the discrepancy between the two is so large that most people would say, why would anyone choose not to go with a Plan G supplement plan? But you are a skilled consumer and you're looking at both of the sides inside of this conversation. And as per usual, there are two more plot twists or asterisks that I need to cover here as well. And we talked through them a bit earlier, but these two things would be drug coverage or Part D and dental and vision. Now, none of these potential costs count towards your max out of pocket or coinsurance or copays. Drugs, dental, and vision are handled separately apart from your supplement or Advantage plan, and they come with their own deductibles, copayment, and coinsurance payments. Now, Part D prescription coverage is handled more or less the same way across both plans, both supplement and advantage plans. Not exactly, but similar because coverage is standardized. Drug coverage has its own deductible, which for 2025 is $590. And for the first time in 2025, it also has its own copayment and co-insurance amount as well, which sits at $2,000 for the year of 2025, which again, for the first time, is a legitimate max out of pocket, which cumulatively comes out to $2,000. And this is the same whether you go with a supplement plan with a standalone Part D or an advantage plan, which includes drug coverage. The difference here being in the monthly premium that you will have to pay in regards to the supplement plan versus the no-cost advantage plan. Now, keep in mind that each plan has its own deductibles, co-payments, and co-insurance structures as well. So there will be more videos to come in 2025 to break these down in more detail, including the drug coverage with a standalone Part D versus a drug coverage with an advantage plan that's included. That said, it's hard to speak too much around the dental and vision portion of this because there are way too many variables to account for. Just know that they can have and usually do have their own deductibles and co-payments and co-insurance amounts that are separate from your max out-of-pocket amount that we've talked about a lot in this video with supplement plans and advantage plans. Okay, now let's look at the total risk with a supplement plan G together with the other plans versus an advantage plan with drug coverage. The total annual risk for a plan G on a good year, meaning that nothing has happened, you don't have to have any procedures at all, is $460 per month or $5,520 per year. However, if you were to have a bad year where things go completely wrong, you have to have 200, 300, 100 different surgeries, and you also have very high cost meds to go along with that, you would be looking at an annual cost of $7,780. Then with an advantage plan on a good year, again meaning that you had nothing going wrong, you're looking at $185 per month or $2,220 per year, which in fact is your Part B premium. However, if you do have a bad year on an advantage plan and everything goes wrong, similar to what I talked about earlier, you're looking at a max out of pocket for that year of $9,220. And keep this in mind as well, if your illness is very expensive and then has to cover multiple years, for example, it starts in August and then carries through to the next year, you're going to then have to pay that max out of pocket for that year, and then it resets in January. So you would have to pay a max out of pocket for the year of 2025 and then again reset that in 2026. So this is just something to consider if you have high medical costs now and that looks to be expanding into multiple years. So in a good year, if you're just looking at advantage plan cost savings, you could look to save $3,300 if you decide to go with an advantage plan. And you could take that money and store it up for if a bad year comes around. But in a bad year, you could look to save around $1,440 if you decided to go with a Plan G supplement plan. And hold up a minute, if you're thinking that I'm in good health now, I'll just go with the advantage plan and then switch to a Plan G supplement plan later on, there are some holes or hoops that you need to jump through specific to your state or your area. Because again, in most states, there are some things that you may or may not understand or know about, and I plan on making a video specifically discussing these details. So if you haven't subscribed yet already, and again, if this video has been helpful so far, please consider subscribing and hit the bell icon so that you don't miss that video. So now looking at all of these numbers, you may be thinking, why wouldn't anyone go with a supplement plan? Or you may be on the other side of the fence and thinking, well, everyone should go with an advantage plan. But the reality is there are a bunch of different variables that go into Medicare costs and Medicare situations that you just have to take case by case, because in reality, though it may look like it, Medicare is not a one-size-fits-all situation. Medicare is as unique as the people that actually use it, and that's why this channel is dedicated to freeing the data and talking about the underlying things of Medicare and the facts that you need to know to be informed to make the most informed decision for you. Because supplement and advantage plans would be like having a Toyota Prius or a McLaren. They both get you from point A to point B, but getting there is drastically different. But the drastically different thing that I'm talking about still fills those holes that original Medicare does not cover. But again, doing so looks very, very different. So if you made it this far, here is the Liberties disclaimer that I have to give in terms of all of these numbers that I just talked about and the Medicare situation as a whole. This video is strictly done with dollars and cents. And though that's what most people, myself included, would be looking at first, there are some edge cases that we have to also discuss as well. Those being where you have to drive for your particular services, the provider that you're going to use, and if that provider is available in your plan, and a bunch of other different things. But just based on solely dollars and cents, it's very hard for an advantage plan to lose. Again, 3 to 5% of people actually hit that max out-of-pocket number that we talked about earlier, and an advantage plan only really loses if you're talking about something like cancer or some other chronic condition, or if you have to have multiple long stays inside of the hospital. So you would actually want to take note of how your costs would look over the long haul, 10, 20 years down the line. I have a video planned that I'm going to do soon that is going to look like this video over here that will discuss in detail how to figure out your costs over the long haul. But there are several advantages and disadvantages for advantage plans and supplement plans alike that you should know before actually jumping to your decision. And I also have another video plan that will look like this one when released, because if you didn't know, advantage plans come with way less freedom and flexibility than a supplement plan. And again, that should go into your decision making when you're making this very important decision. And there are a lot of incorrect myths about this, but in reality, a supplement plan does have way more flexibility and freedom that you are given based upon the fact that you're paying for it. But if you do decide to go down the supplement route, you again will pay for it, which is why for many, it's not about just the cost solely, but they're also weighing whether or not they have the freedom and flexibility for exactly what they want and when. All right, so if you made it this far, I have to be completely transparent here. I cannot, in good faith, just solely recommend one plan over the other. Because again, there are way too many variables and factors that we have to come into contact with while making this decision. And if anyone does say that you should go with always going with a supplement plan or always going with an advantage plan, that's a little hard to say that that's 100% always the case and the truth, because there's just way too many variables to account for here. And it does, although it does and is the sexy thing to do and does get clicks, but that's just not how I do business. And so if you actually made it to the end of this video, the secret comment code that I need you to put down in the comments is, who is your favorite X-Men? And if you don't have one, put Storm, because she is my favorite. But if you do need help with your decision in terms of Medicare, feel free to reach out to me at benefitsnerds.com, or you can feel free to email me as well. And my email is inside of the description of this video and will be pinned to the pinned comment of this video as well. As always, thank you for your time in watching this video. And here's another video that I think you might enjoy. I'll see you over there.